Hello, I'm Dr. Carlo Demarco, CEO and co-founder of MindMinder Psychology Center UK, and I'm a doctor, PhD in psychology with over 25 years experience in the field. Anger, this is what I'm talking to you about today in this video and in the following few videos. Anger is, according to the APA, the American Psychology Association, is a feeling, it's an emotion characterized by antagonism towards someone or something where we feel that they deliberately done something wrong to make us feel bad. Or sometimes we even take it personally that we feel like this way about incidents that happen in our life, be it like being stuck in traffic jam or maybe standing in a queue for a long time in the post office or in the supermarket. With anger, like every other feeling, it's there to facilitate our life. It was designed this way, same as anxiety. It's there to make our life better, but it's only when things go out of hand where we need to control things up and control our anger. One of the examples I can give you for why anger can be good in our life is in case that someone come to rob your house. You would need anger to be able to fight back and protect your property and your belongings. Otherwise, you can imagine what the consequence would be. So we need anger, but when things go out of hand and we don't control this anger, this is where things go pear-shaped. We have the sneaky anger, and this is the kind of anger that you would feel that it just sneaks on you. It just comes out of nowhere. You just be sitting there and it just happens. This is the kind of anger that many people would suffer. And then we have the paranoid anger, and this is where you feel angry because, let's say, you are in a new setting, in a party or in a new job or something, and then because you are paranoid about everything around you, or feeling that people are maybe talking about you or making some gestures about you or something, then the feeling starts increasing, and then you start feeling anger at the whole thing, the whole sitting with the people and the place that you're in. The sudden anger, and with the sudden anger is slightly different from the sneaky anger, because sneaky anger, you don't feel it as it's happening, it just sneaks on you. With sudden anger, it just happens straight away. Yeah, you're calm, and then all of a sudden you get so angry. And that I saw it happening in many cases where you're driving the car and someone does something or rebuke you or something while you're driving, and then you lose your temper all of a sudden. Shame-based anger. Shame-based anger happens with people who are highly sensitive about who they are, who lack a lot of sense of security. They're looking for reassurance all the time. So due to this feeling of shame that they're holding inside, they are looking always for reassurance. So when they don't get the reassurance they're looking for, they just latch to some kind of anger. And one example to that, like for example, if like a person is dressed in a certain way, if a lady dressed in a certain way, she expects a compliment from her boyfriend or husband, and then he doesn't offer this compliment, not because he doesn't like how she looks, it's just so happens, and she could get angry and mull about it inside because she feels like he's not taking notice of how she is, and maybe he doesn't love her. Deliberate anger. Deliberate anger is where people would use anger, and they are very clever people who use deliberate anger because they know when to switch the anger on to reach and achieve a certain goal in their life. With deliberate anger, you would be in control of the whole situation. You would get angry, you switch the anger as a method of blackmailing someone. If you don't do that to me, then I will get angry. If they do it, then okay, I'm going to be calm and I'm going to be fine. And this is another kind of anger, and it's very common in couples, especially addictive anger. With addictive anger, it's you can imagine like it's when anger becomes like an addiction. Some people, they have like very, very monotonous life where there's nothing exciting happening to make them feel alive. And then they need that rush of high emotion that comes with the anger. And you find them every now and then, they just have to do an outburst of anger so that they feel alive again. And then it becomes, after a while, it becomes an addiction that every once in a while they have to activate this anger to, obviously they don't do it consciously, but it happens on a subconscious level. They have to do it just to feel alive again, and that life is, has something happening in it. And then after that, we have the habitual anger. Habitual anger is very common also, where a person is having a certain habit that I get angry at 5 o'clock, or I get angry when I walk in from work. And you kind of like, some people, as soon as they walk home and they see their wife and children, and they get angry. Or the boss in the morning, when he sees his staff, he gets angry. Or when he sees a certain person, he gets angry. And then this becomes a habit. And you find yourself getting angry just as soon as the conditions are provided, whether it's time or space, the place, or you see a certain person. So the moral anger. Moral anger is when you have a certain cause. You're a person like a crusader, that you're looking for any cause to protect and to defend, and then you are morally correct, and you're always seeking to basically fix the world. So you are a moral anger sufferer because you are looking for ways of releasing this anger by being morally correct. It works both ways, so you can have a certain morale that you follow, and then if it doesn't happen, then you would get angry, and you would express it maybe in a hostile way, aggressive way, and maybe not. And then it could work the other way around, that it becomes, if you have a mix of the moral anger and also the habitual anger, then you would, if you have a habit of getting angry, then you would be looking for some moral issue to defend that you can't pass by without getting angry, and then you would do it. So as you can see, it's a bit complex, that sometimes one or two of these styles of anger can mix with each other, and then they make matters a bit more difficult. Hate anger, where you feel like sudden hate towards someone. It could be sudden, or it can be prolonged over a period of time, and then you feel angry at that person or that place or certain condition. Healthy anger, because anger is not all bad, as we said in the beginning. With the healthy anger, this is the anger that is expressed in the correct manner, and this is the kind of anger we are seeking to achieve through anger management. I get some of my clients, they ask, "Doctor, am I going to stop being angry by taking an anger management course?" And of course, that's not the idea. This isn't what we are doing here, because we're not here to eliminate your anger, because this is part of the emotions you are supposed to have as a human. But what we do is get rid of the aggression and the anger and make it more manageable, where you can control it and not suffer consequence of the anger itself. Like everything else, there are signs of anger. You would feel it once you start getting angry, and these are what we call anger cues. And the cues to anger are on 4 different categories. One of them is emotional, where you start feeling the emotions of anger boiling inside and feelings are rising. And the other category is physical, where you feel like you are clenching your fists. Maybe your heart rate is getting higher, and you feel like you're maybe sweating. You feel like you want to express your anger. You want to punch someone, punch something, etc. And then there's also the self-talk, where you start talking to yourself. You start thinking to yourself and imagining things, imagining what you would do to the person. Once you recognize the triggers to your anger, then you're halfway there, because if you can avoid these triggers, or at least if you can recognize the triggers and control your anger after these triggers, then you're halfway there. I'll give you a quick fix for anger, because how to manage it, of course, it's a course that we do over 6 to 8 sessions, and with almost 100% success rate with most of our clients. And the quick fix to control your anger, I would say to take a deep breath. You do the breathing exercise that we do with our clients, is where you breathe and inhale for 3 seconds, then hold your breath for a second, and then exhale for another 3 seconds. Then if you do that over a minute, you will feel better. If you do it like 3 times over 3 minutes, then that will increase the flow of blood and oxygen into your brain, and it will automatically reduce the level of stress that you'll be feeling that's associated with anger. Take time out, and by time out we mean that especially if you're triggered by someone that's been causing you the anger, maybe you can take a time out. You don't have to tackle the situation there and then at the same setting while standing talking to them. You can just ignore the situation and then over. But obviously, if you're dealing with like the situation, you're dealing with a partner or something, then you can agree with that person, explain to them what you're doing, tell them I'm taking a time out now, because if we talk about this now, things will get worse. Let's revisit this situation when we're both calmer, and take time out, go do something you like, maybe have a drink or go for a walk, drive the car, do whatever, play with the cat, anything. Do the progressive muscle relaxation. That's exercise also in many other techniques and in other capacities, which would mean that you do a muscle relaxation, start scanning your body from toes all the way to your head, and you tense and release each muscle as you move from your toes all the way up. Try these methods and see what works for you. If you feel like you want to know more about anger, which I urge you to do, I would suggest that you subscribe to this channel, as we will always come to you with the latest in the field and with more information that will benefit you for your own self-help and self-development, and we will always be there. Thank you for watching, and look forward to talking to you in the next video. Take care.